Dear Chairman, dear colleagues, my topic is hypocitraturia and recurrent prevention in calcium oxalate stone formers. Hypocitraturia is a common metabolic abnormality in stone formers, which plays an important role for recurrence prevention. The objective of this study is to identify the incidence of hypocitraturia in series of stone formers, to compare patients' characteristics and the efficacy of medical treatment and diet in patients with hypocitraturia and normal urinary citrate. A prospective study of 190 calcium oxalate stone formers was performed between March 2017 and March 2021. All patients underwent specific metabolic evaluation with 24 urine collection, blood tests, and stone analysis. 58 patients had hypocitraturia and 61 normal urinary citrate. All patients underwent intervention with general preventive measures. Pharmacological therapy with potassium citrate was initiated in all patients with hypocitraturia. Patients' characteristics, compliance, and efficacy of therapy at first year follow-up was analyzed. Results. Patients with hypocitraturia were more likely to be female, to be recurrent stone former, to have a solitary function kidney, and comorbidities. Hypocitraturia patients had a significantly higher incidence of associated hyperoxaluria. Following therapeutic intervention, the mean urinary citrate in patients with hypocitraturia increased significantly to 563. However, 4 patients still had hypocitraturia despite intervention. Patients' compliance to general preventive measure was moderate. 11 patients with hypocitraturia discontinued alkaline citrate due to undesirable side effects. You may see the stone recurrence and stone growth in first year of follow-up. In a group with hypocitraturia, the stone recurrence was around 13%, and 26% was stone growth. In patients with normal citrate in the urine, the stone recurrence was around 13% and 15% of stone growth. In conclusion, hypocitraturia is a common abnormality in calcium oxalate stone formers. Following dietary and medical intervention, urinary citrate increased significantly. However, there were no statistically significant differences in stone recurrence and stone growth between the two groups, suggesting that hypocitraturia is not the only contributing factor to stone formation.